लिखा है. That's not me. I just
This
said
is for Bharat Kothari. Bharat Kelkar.
Okay, we are starting now.
Yeah, starting
now. Yeah.
Hello everyone, this is Aditi Patil, the student coordinator for this meeting. I welcome you all to this virtual reunion. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean SAGES Medical College and KM Hospital, welcomes you to this session of Reminiscences. Welcome you all to this virtual reunion. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association.
Hello, please mute off.
Dean SAGES Medical College and KM Hospital welcomes you to this session of Reminiscences. Welcome you all to the virtual reunion. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association.
Hello, please mute off. Somebody.
Dean SAGES Medical College and KM Hospital welcomes you to this session of Reminiscences. SAGES Medical College and KEMH Hospital will be celebrating its centenary year soon. As we prepare for the centenary celebrations, we have a message from our Dean, Dr. Sangeeta Rawat Madam, in the form of a PowerPoint presentation. I request Badal sir to please play the PPT. It is the students' past and present that makes our college what it is. So, as our twin institutes move towards their centenary, we wanted to give you all a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotions will be preserved forever in form of these reminiscences. Badal sir, can you now please show the GA membership form? Thank you. To remain connected to our alma mater and informed about the activities in KM, including its centenary celebration, we request you to become members of the Gosumec Alumni Association, the official alumni body at SAGE GSMC. All the details on how to become a member and this membership form are available on the KM website. All those who are not members as yet are requested to please visit the KM website. Sir, can you please show the slide of students collage? This is the GOSUNION student team who coordinate all the virtual reunions of almost all the batches. Today's student coordinators are me, Aditi Patil, and Varun Sawant. Now I would like to request Dr. Pankaj sir to take over the proceedings.
Pankaj is muted. Now, okay. Can you
Yeah.
hear me?
Yes,
Pankaj
yes.
sir, you are logging from two devices, so can
Correct.
you
I have
log
stopped.
in?
I have muted myself from on one device. Okay.
And also stop the audio sound.
Sorry.
Turn off the volume button. Turn off the volume button of another device.
No, I have muted one laptop, and on the
Okay.
mobile I am unmuted.
Okay. Okay. Okay.
Okay. Yeah. So how about starting from the reverse order? Like Kanchan is there today. She was the Y batch. So why don't we start with you, Kanchan? You tell us what
Hello,
you.
hello everybody. Pankaj, what exactly do you want me to start with?
Why did you join the GS Medical College?
Why did I
Why not
join
GM?
GS Medical Colleges? Because when we were getting admissions in 1975, it was
Ah,
supposed to be the topmost college in Bombay, very well
India,
known
India, India.
in India. And yes, that was the main thing, and the teaching was supposed to be very good. I didn't know anything about GS because my three elder siblings are GM sites.
Okay.
So, for me, when I joined there, it was like a shock. But I don't think I regretted anything. I enjoyed all my years in GS as undergrad, as postgrad. And of course, I had the opportunity to, visit intermittently. So I remember all the teachers. And as you know, we always, cherish what they have taught us.
What is the one memory, most vivid memory that you carry with you about GS?
You mean during my school days,
No,
during my
about GS, about GS.
about GS?
Yeah, something that you most vividly remember. Any incident in the wards, with the teachers, with your friends, in the college week, in the hostel, whatever.
So the most vivid incident I remember is that me and Nishit Shah were chit-chatting at the back in the forensic
Lecture
class,
theater.
and we were thrown out of the class, the two of us, and that was just about a month before the exams began. And
Which
then
exam?
after a week later, professor called us and told us this is not the way to behave. And then he said, okay, you read these topics, and like you've missed out on your tutorials. And guess what? It was almost 50% of the paper. So that is one of my vivid memories, that the teachers were strict. At the same time, they were also very caring, that you missed out on your tutorials, so please, go ahead. That's one memory I won't forget.
So one person is listening very intently to you, and that is Chitra.
Is
She was,
it?
she was the girl who joined GS Medical College as #1 student. So tell us
Yes.
something about GS, Chitra. Unmute yourself, Chitra.
मला वाटतं सगळ्यांना मराठी कळतंय, त्यामुळे मी मराठी बोलते.
बोला, बोला.
बोलू ना?
Oh,
Or
oh.
anyone of you don't understand Marathi and it's mandatory to talk in English? काय वाटतंय?
Go ahead, go ahead.
Anyway, when I stood first in university, I was shocked because I didn't expect that to happen. And naturally, I went to GS Medical because I didn't have any history of my elder sibling or anyone going to other colleges. And with my friends, of course, we decided to choose this college and we came. We had very good memories around college, but all those are related to my friends and not, professors as such. But I would like to tell one thing about physiology teacher, uh, Kendurkar, right? Nimu, yes?
Yeah, Kendurkar,
Ah.
Kendurkar, yes.
Yes. So she was the one who told me to take pediatrics, I remember. Because what happened when I went and met her after I passed, we passed third MB. And I said, okay, I'll take gynec because I feel it's much less tiresome and I mean, that was maybe माझं चुकीचं असेल त्यावेळेचं perception. But I decided to take gynec and go ahead. So what she said, do you know what is gynec, Chitra? It's one uterus and two ovaries. She showed me this way. So it's just limited. I don't, आता विचार केला तर मला अजिबात हे योग्य वाटत नाही. पण that time I thought this. मग म्हणाले की why don't you take medicine branches? So go for pediatrics. I said, okay. म्हणजे माझ्या डोक्यात तर काहीच नव्हतं. I just decided to go for pediatrics and I went there. And so that I remembered, and I remember that whole incident. And then I came back and told my friends that I'm going to take pediatrics just because Kendurkar madam told me. That's what happened.
Great. So from Y we come to T. Sunil Tiwari, please unmute yourself. And Chitra, you can now mute yourself.
And one more thing I want to tell you about Sunil, because what happened during MD exams, that was very, I was pregnant and I had all, I mean, first vomiting and initial those problems. But Sunil was the one who used to go and attend those, read in the library. And then he used to tell me about all those recent things, मग कॉम्पिटिशनच्या वेळी कसं असतं जनरली की सांगत नाहीत, हे सांगायचं नाही, ते सांगायचं नाही. बट आय हॅव व्हेरी गुड मेमरीज ऑफ दीज फ्रेंड्स की ते यायचा तो आणि मला म्हणजे वी यूज टू डिस्कस, प्रवीणला आठवत असेल, प्रवीण जैन, की वी यूज टू डिस्कस इन बाडिया. बट सुनील यूज टू टेल, तो म्हणजे मला असं वाटलं कुठे याच्यात कॉम्पिटिशन आहे, हे सगळे जे वाचून यायचे नवीन नवीन गोष्टी. आणि आय नेव्हर यूज टू गो बिकॉज आय यूज टू गेट सिव्हिअर व्हॉमिटिंग. आणि मी आपलं वाडियात बसून अभ्यास करायची. सो आय वोंट फॉरगेट दॅट इन्सिडेंट. म्हणजे ॲज अ फ्रेंड, all these were, I mean, very, very nice friends.
No, I will vouch for him. Sunil is a good guy. Aren't you, Sunil?
Hi,
Unmute
Pankaj.
yourself. Hi.
Hello.
Bolo, Sunil, my question to you. Which was the most masti wala moment for you during your time in GS? Masti wala. Serious nako. Can't hear. Unmute, please. Sunil, unmute. No, you are still muted. Unmute.
All are muted here. सबने म्यूट करके म्यूट का बटन कम करो, दबा लो.
सुनील बोलना चालू करो यार. Let him
Sunil,
speak.
one second, please. Sunil, touch the screen. Touch the screen. On the lower left-hand corner, you will see unmute. Touch.
Yeah.
हो गया. Come on. Most मस्ती वाला moment.
अरे मस्ती वाला तो बहुत सारा था यार.
हाँ तो most बोलना.
Most माने क्या है कि we remember we were always attending MLT as a heckler. So once I heckled Rajesh Parikh a lot, and he became so angry. Then after the meeting was over, he literally threatened, Sunil, now don't heckle me ever again. I will beat you up physically. मैंने कहा okay. Next day again there was some meeting was there in MLT, RRDD department, and again I heckled him, and he just kept quiet. So बहुत सारा था. हाँ.
Right.
But what Chitra was telling, हाँ, वो ऐसा तो मुझे कभी लगा नहीं. But she was so nice girl, and she taught me a lot. हाँ. In fact,
अभी तो ऐसा बोलता है. अभी तो ऐसा बोलता है. पहले मेरे को कुछ और ही बोला था तूने. Okay, Lalit, your turn. Unmute.
ठीक.
Yeah. Okay.
Hi everybody.
Hi.
Can you hear me?
Yes.
So what's the topic?
Anything. Anything goes.
No. Anything goes. Okay, let me scratch my head. So I'm a cardiologist, and I'm thinking, when did that decision come? Believe it or not, it came in the first semester of first MBBS. And you look at the physiology things that we had up until the time of the Shirvalkar exam. If everybody remembers the Shirvalkar exam,
Yeah.
we had anatomy and physiology. So in physiology, there was this thing about
ILAD. Yeah, go ahead, go ahead.
So there was this question about cardiac cycle. If everybody remembers, I don't know who the teacher was, but he or she did a tremendous job of putting up a diagram and showing all these little intervals of cardiac cycle. And that showed up on the exam. And it came through very well. I could reproduce the diagram. And I was fascinated by the entire thing. Not as much as the anatomy part, but the physiology of this thing struck me. And I think that was the turning point, and straight the road ahead was cardiology from that point onwards. So I think that was my path to career. And I will leave it there.
Okay.
Pankaj,
So-
if I may, to just add to Lalit's, the teacher who taught cardiac cycle so nicely, at least the ECG part was Dharani.
KB Dharani.
And I distinctly remember he played a very, very important role even in my life to that regard. The ECG triggered the career choice, and I think I did so many other things in my life, in my career, and it came as a full circle. And then here I am, I think. So I think the ECG was the initiator. And I don't know whether Pankaj, you want me to just kind of take this opportunity to kind of, just take on. But my memory of the MLT, of course, there's so many things that we participated. But one day during MBBS, first MBBS, I came a bit late to go to anatomy. And right at the MLT, at the staircase, there were so many people just waiting outside. And I said, okay, let me go inside. And I made myself in. And the hall was packed with not just the physicians and students but the nurses, and a couple of nurses actually had lost consciousness, fainted, syncope, and that was the Christian Bernard seminal lecture that he gave on heart transplant. Not that as a first MBBS student, I even remember anything or understood anything. So many things about immunology and the transplant. And I think, it just kind of, something that sticks in your memory forever and ever. All these things that we had at KEM. So again, thank you so much.
Great. So you all are the torch bearers of our class. And since both of you mentioned Dharani, I will now hand over to Jayesh Kapadia. Okay. Who has joined as Oppo A31. He has not written his name.
Yeah,
So,
okay.
go ahead, Jayesh.
Hi, Pankaj. Hi, everyone.
It's up to you whether to mention Dharani in the story or not.
Yeah, of course. Why not? So during the physiology lecture or laboratory where they taught
practicals.
How to take blood pressure. From Pabi was there and he took my blood pressure and he said, bloody hell, you are 240, 140. So they rechecked a couple of times. Then they call Tarani sir and he also rechecked it. He rechecked in both the limbs, called me every day for on the same time for a few days. The blood pressure always was 240, 140. Went back to VNA, VN Acharya for kidney workup. Everything normal. Went to cardiology department and there KG Nair and Jaikar. He was, I think, the registrar of KG Nair at that time. And they diagnosed coarctation of aorta at that time. So that was the story of the first MBBS. From that day onwards, I forgot anatomy and physiology, just read cardiac books. And one of the books that I still remember was by some Woods, about 1,000 pages book, Woods. And I was operated in December of the same first year MBBS by Dr. Sharad Pandey and Dr. Chokar. Chokar's unit and Sharad Pandey opposing unit, but came together for me. Bhattacharya was the tutor, Manke was the registrar at that time. Dr. Sandhi Shah was the registrar and the second registrar. And they used to take me to the rounds to hear the murmurs, and I was supposed to be first MBBS cardiologist that way. And of course, then I think the best part was that when GBP came for the rounds, Jayesh, I think you are saved today. You are lucky because there is no hemorrhage in the GI tract. Otherwise, there should have been a hemorrhage, you know. So that was GBP's tone.
Okay. Everybody, please note Jayesh's jet black hair. Not a streak of white.
They are original hair actually. And at present, I am in a more of in a malnutrition work in the kids. I must have seen about 1,50,000 students free of charge across India, across Gujarat and Maharashtra basically. And we are having major plans for bringing into various doctors, various teams of nurses and ASHA workers and other workers of the health authority, health system of India. Let's see how far it goes. I don't know.
So that's another trailblazer from our class. From Jayesh, I go down as I see on my screen to Shivaji Mane, another torch
Hi.
bearer.
Yes.
Hi, Shivaji. Please tell
Hi,
something
everyone.
your experiences.
Yeah, I joined MBBS GS Medical College. Not that I know much about. There was nobody really, anybody from medical background from my family. But just I came to know, asking some general practitioner in my area, which is a good college, hospital. So he suggested GS Medical College is the best college that we must join, and that is how I entered in the GS Medical College. Second most important part, I still remember my first MBBS to till internship. First thing is that on my first day of my MBBS, I bunked the college and went for a Sholay movie. If you remember, that time it was in 75, it was released in the theater. And the
15th August
Yes,
1975.
yes. And that the second day, the 16th, I went to the movie. And also, I remember at the end of my MBBS during internship, again I saw the same movie again, Minerva. So that is something which I remember, that movie was running in the theater for 5 years. So that is I still remember very distinctly. And third thing which I remember very nice is that I used to represent our class for both the sports, kabaddi and volleyball. And I still remember there are many our colleague friends, those who are not participating in the game, but they want to be, because we used to get extra marks. So they used to come and say, no, because I used to be a captain. So they used to say, no, can you include me as an extra player so they can get a certificate? So this thing I still remember. I don't want to name the people who used to come and join, ask me to keep me as an extra player for that game. And as we know, most of by the end of my whole thing, I choose to become the pediatric surgeon. And then subsequently, uh, I spent another year in Wadia post MCH. Then I went joined JJ, worked there for 7 years as full time, and then I've been honoraries in JJ till today. And so go to JJ hospital once in a week, take my classes, take the OTs, and continuing as a interest specifically in the hyperspadias and DSD, that is the intersex cases. So which I enjoy doing, working today at Jupiter Hospital with Pankaj and Makarand in Thane. Hi, Samir.
Yeah.
Yeah.
Shivaji Mane is the #1 guy in hypospadias in India and maybe, I don't know, in the world also. One of the top 10 perhaps, if not the first.
Not in
That's
the world,
what I'm being told.
I can proudly tell you that I have conducted almost 30 workshops in India for both pediatric surgeons, adult urologists, and even plastic surgeons. So
Great.
I do whatever the technique that I do is accepted by, I written contributed in a textbook of pediatric surgery. Also, one of the textbook in a DSD, which is a published chapter on the feminizing gender plastic, and also on hyperspadias in Indian Journal of Pediatric Surgery.
Unfortunately, Shivaji is a very quiet guy, and does not blow his own trumpet. Otherwise, he would have been much ahead of anybody else. We come to Sunita now. Sunita is there online. Yeah, unmute yourself, please. Unmute. Sunita,
Okay. Yeah. So I'm representing both Prabodh and myself because I don't know where my husband is currently. And
okay.
so it's nice to see so many of you together. And it's fun being together. I wish we could talk more often like this. Okay.
Anything special about your time in GS you would like to talk about?
Well, I got my life partner there. What more can be special? And friends like y'all.
Arey, you can talk about the trek that we went in 1977, man.
I know how the boys and the girls fought.
Speaking of the trek, one couple was formed on the trek out there. And I can see that gentleman with the nice green background behind him smiling away. Mahesh Balsekar, please unmute yourself. Mahesh, please unmute. Yeah.
Hi, everybody.
Hi. Bolo. Mahesh, you are in Bridge Candy, right?
Yeah. And the SRCC Children's Hospital.
Okay. You are also there. So how are things out there? South Mumbai.
Good. There's complete contrast. Breach Candies for the privileged upper income, and SRCC has a lot of low income and scheme patients and government schemes. So it's quite a diverse practice.
So anything non-medical do you do nowadays?
So I've started a trust like some of the classmates. It's called Healing Touch. So I raise funds from well-meaning, affording patients who support. And I sponsor low-income children for complicated medical disease. It's been going on for almost 20 years now. And it's been...
But it's still medical, semi-medical, no?
Mainly medical. I've done a little bit for orphanages and education during COVID time, but largely it's for medical.
Okay. From Mahesh, we move on to Samir. Samir, I thought I saw you. I heard you saying that you are on a liquid diet and not able to speak or something.
What kind of liquid diet, Samir?
That's an important question.
Okay.
Hello.
I will just say first I start with
boy phone kindo.
Jayesh, mute yourself, please. Here, Prabodh has come online. Hi, Pabi. Unmute yourself, Prabodh. Lower left corner. Touch the screen. Touch your screen. Lower left corner. Unmute.
He might be driving the car right now.
Looks like, yeah. Anyway, back to Samir.
Yes.
Are we allowed to mention nicknames given to each other during the class?
Of course.
Samir,
Of course
are we allowed?
Yes, you are always allowed, yeah.
Okay. Go ahead, please. You are talking.
I start with simple thing. Gujarati mein I will say, Ajaniya apne malya.
Yeah.
Jani ne chuta padya.
Yeah.
Ajaniya apne malya and Jani ne chuta padya. So, like in 75, we all met together. We did not know most of the people. 75. Hello.
Yeah, go ahead.
Yeah, and 5 years darmiyan, we learned a lot of things for a lot of people. And one thing which probably the hospital gave me was the interest in the dramatics. That I did 3 dramas in St. GS Medical College.
Yes.
Sobanu naam Lili Nathi, Bag Mama Mami Avi, and I forget the third one name, the 3 dramas, which made me a lot of interest in the dramatics.
For Marathi, we had the Marathi Wangmay Mandal.
Yes.
What was the Gujarati counterpart?
Yes, Gurjari.
Gurjari.
Wallpaper.
Yeah.
And I remember I would write the article and Shekhar Bujraj would draw the picture for the same,
Yeah.
So beautiful that I enjoyed 3-4 years of Gurjari wallpaper.
Yeah.
Vipla used to write. I don't see him real.
Okay, Samir, Samir, you can mute yourself now.
Yes.
We go to the other Sa on the screen. Our first, not really the first, but the last and permanent class representative, Nishit, the first DM endocrinologist of India. Yes,
Hi.
Nishit, go ahead.
Yes, can you hear me?
Everybody can.
Okay, fine. One thing which I wanted to mention is that the bond of fission, when there's lots of pressure, is something which does not break ever. And the pressures of studies which occurred in the first 5 years of life has kept the bond so tight that they will never be unbroken again. So that's the lesson which I learned. About the amusing incident, the best part of our life was the library was on the ground floor. And we could sit and talk and chat each other, not like this new modern building where it's away from everyone. And we were sitting together, and suddenly one day, some person came and gave passes for circus. And we all went for circus. And I don't know whether you can remember the lion shit incidents. Can you?
No, we don't.
Dwarka was on the front line.
Yes, yes, I remember.
And suddenly the lion shitted, and then it's passed his paw along, and it all fell on Dwarka. So he was one of the few person who was showered with shit from a lion, and probably the only one from our class or for many years. So that was the proudest moment was, of course, when we were holding the shield of the sports trophy, where I was the CR and I was catching the thing. So that's the proudest moment. And otherwise, the thing which is happening is that because I am in Hinduja now for 37 years continuously as endocrinologist, and I had the pleasure of training at least 20 plus endocrine, which is what I think I have done my best achievement. I have also been in contact with many of our former teachers, KG Nair, Monkar, FD Dastur, Bhalerao, all of whom have unfortunately have passed away, including Dr. Motasha. So they have been in contact while they were in the hospital, and even Professor Bhandarkar did come to the Hinduja hospital as my patient. So that was my privilege to be able to treat my own professor.
Wow, that's great.
And that was the memories which I can share at present. And of course, lots of things do happen, but as I mentioned, the bond which has been formed with something which is Fevicol will never be separated again.
When you talked of pressure, was that pressure equal to the pressure you felt in the local train when traveling from your house to the college?
Okay. Yeah, now one incident, Dr. Mashur was also at KEM and was at Hinduja. So first thing which he said when he came in, that Nishit, I didn't know Hinduja would be so crowded. So I said, yes, the difference between KEM and Hinduja is the difference between second class and first class in train. Crowd वही है, सिर्फ बास नहीं आती है.
Wow.
So that's my memory of Dr. Mashu. All of them have passed away, unfortunately. There's one more person who was retired but not passed away, Dr. R.B. Deshpande. If you remember, he was a pathologist. Pathology demonstrator. You remember once he wanted to show a mole and opened his shirt, and then he showed the mole on his front of the chest, and suddenly he realized all the girls are peering at his hairy chest. They suddenly closed it up.
Okay, we go to Hede, the hybrid Hede, as I might call him. Hede, you will have to unmute yourself. Vidyadhar Hede, please unmute yourself. Unmute. Are you on the laptop or on the mobile, Hede? Say one for laptop, say two for mobile. Raise your finger and tell me, laptop or mobile? We can't hear you. We cannot hear you, Hede. You're on the mobile. Touch the screen. And in the lower left corner, you will see unmute. Now, where is Hede gone?
Till then, ask somebody else.
Yeah. Ashok Dalal. One of the three Dalals. Unmute. No, unmute, please. Ashok, unmute yourself. Ashok, unmute.
Now?
Yes. Okay.
Yeah. Bolo.
Go ahead. Tell us something about your time GS.
No, when we cleared our inter-science, it was a question where to go, which college to go. But Dr. Hina Rajdev was staying in my building. Hina Rajdev. He was assistant professor with Dr. Vaz's unit. And she told me, of course, you have to go to KM hospital. And she helped me out for the medical certificate, everything. And I got admitted there. And there I saw about 30 students of my vernacular section of Jain College in our KM hospital. Like Subhangi Thakur, Megha Sodagar, then Vijay Rilkar, Patankar, Ajmera, and our Gujarati, Viplav, Mahendra Merchant, so many, Bharat Pandya, Nitin Kamdar, everybody were there. It was a good welcome for the in a KM hospital. And second thing, after clearing MBBS, my first choice was anesthesia, but I was not getting anesthesia. But ultimately, Bakshi, what was the first name?
Anjana.
Anjana Bakshi got married and she left. That's why I got the admission in anesthesia. And somehow I could manage to pass anesthesia.
I got anesthesia, but I did not take it up, and that is how you got it.
How?
I got anesthesia, but I did not take it because I didn't. We were not comfortable with that anesthesia course. So then I gave it up, and you got it. I got the pediatrics. I had applied for pediatrics, but I didn't get pediatrics, and I got anesthesia.
Okay.
Yeah.
So say thanks, Ashok.
Bolo.
Say thanks to her.
Anjana,
thanks. Of course, I thank her. Number of times, whenever I meet her, I thank her. It was because of you, Anjana.
Yeah.
Anju. Yeah.
Okay. Okay, guys, go back to muting yourself.
Okay.
We move on to the other hybrid guy with his hands behind his head right now, Dwarkanath Nair.
Can you hear me?
Yes.
Okay. Now, I mean, lion shit you heard. You may have also heard of me being the only. You may be me being the only Arab Sardar. Anyway, the one incident, I'll make it short because there's so many people have to talk. First surgery rotation, Dr. Devdar's unit, our registrar, Dr. Mahendale, and the topic in the clinic room was post-laparotomy, return of bowel sounds, how do we know the bowels are moving, and with various descriptions and all that. There's one was that you put a rectal tube, and then how do you know the patient is passing gas? That you would say you put the other end of the tube in water, you can see air bubbles going on. So one of our classmates, I don't know if he's online, suggested that the easier way would be to put a whistle at the other end. That you would know.
I suspect that classmate was you yourself.
No. I don't know if he's online, but it was Venkat.
Achar, Venkat is not there.
Okay. So he won't mind me telling the story, but so that was my little short incident. So go ahead.
Yeah. What about that glow?
Yeah, you will need more time than the allowed time by Zoom for me to finish that story.
Yeah.
So we'll let you pass
Medina
this time.
story.
Yeah.
Firoza Dalal was there online some time back. Is she still there? Firoza is not there. Okay, Hede, have you been able to unmute yourself, Hede? Hede is not responding. So, okay, now I'll come to myself, recalling humorous incidents during our time. So, as was mentioned earlier, we had this library on the ground floor. The seating arrangement was in a C shape, and we were sitting in the extreme corner, okay, and preparing for our third MBBS exams. So next to me was Pinto, Sebastian. Opposite to me were Freni, and Vijay. Vijay right opposite me, Frenny to his left. And Pinto suddenly got a gadget out from his pocket. You know those small view masters in which there were small slides and you held it against the light and saw those pictures. And those were all, X-rated pictures that he had got. So he passed it on one by one to us and we all had a look. Now, in the meantime, Frenny went out for a break and somebody said, give it to Vijay, give it to Vijay. So Shishir Dhruv passed on this view master to Vijay Haribhakti. So Vijay had a look at it and just passed it back. So everybody was, stifling their laughter. Frenny came back after a while and he sensed that something has happened. So she started asking, क्या हुआ, सब लोग हंस क्यों रहे? So somebody said, ask Vijay. So she asked Vijay, what happened? No man, they showed some Graphian follicles to me. Graphian follicles, God knows what he saw in them. Mahesh Doshi is online. Mahesh, unmute yourself. Mr. Ghatkopar, unmute. No,
Yeah,
we
yeah.
can't hear you. Yeah, okay.
Yeah.
Go ahead, Mahesh.
Yeah, we have been meeting out. Of course, I left after MBBS to do my master's in general surgery at Science. So I had little less attraction as a postgraduate student.
Yeah.
Yeah, but as a undergraduate student, okay, yeah, we still remember those library days, as you said. We used to chat outside, also sit, also.
Hede, have you unmuted yourself, Hede?
Hede is still seen? I don't.
Can the coordinator unmute him? Can Aditi, can you unmute Vidyadhar Hede? Pabi, can you come online?
Sir, please unmute yourself.
Kadal sir, can you try unmuting him?
Yes, but sir, I have to unmute from there.
Pabi, you are muted. Pabi, unmute. Okay, Jania. Come on.
Now you can hear me? Can you hear me?
Yeah, we
can. Yeah. So my the best moment of my life, I think, was the time when between our third MBBS and internship, where Sunita, I, Smita Joshi that time, and Surit Parekh, of course, the great Surit Parekh, I think, whom all of us admire and we all missed. I'm sure you'll agree that he was the finest guy who ever lived, and etc., etc. I think any superlatives are too little for him. But anyway, and Ajit Gurjar, we went for a 1 month skiing holiday to Gulmarg.
Okay.
And all the time, Ajit Gurjar was, kept on, and people kept on telling him, why are you good, man? I mean, here, Pabi and Sunita are already kind of, a couple, and Surit here was trying to his level best to get closer to Smita Joshi that time. And Smita wasn't really inclined. And, Surit saw it as his last
We lost him.
I think his network is poor.
bloody handi. Handi, kitla handigiri karta hai, so useless fellow. Don't go. But believe me, we had one of the finest times and we were witness to the blossoming of a phenomenal romance between Smita and Surit. And, when we came back, they were a couple and then they got married, etc., etc. And then, the rest is history. Unfortunately, we all know what happened. And, I think he was one of those 3 or 4 people whom we have lost so far. Another guy whom I think Kanchan will testify, we were both involved in his sad demise was Jagdish. Jagdish, what was he? I forget his...
Vaswani.
Yeah, we both had to operate on him. He had a transplant. And he was a very, you all have heard about mucormycosis now after COVID. But this was maybe 87, 88. We had to operate upon his mucor in the sinuses at that time,
And it was quite a sad story operating on our, Nishit had the privilege of treating his bosses, but we've had the sad privilege of treating our own, classmate, and unfortunately we couldn't save him. And those days there was nothing available to treat the mucor. So very quickly, I think he went downhill, and he was immune compromised. His kidney had failed. He had a donor unrelated kidney, etc., etc. I mean, anyway, that sad story aside. But otherwise, I mean, to complete my story, I think I can't. Lovely bond with.
Bobby, we are losing your audio.
We found
Maybe.
Yeah, I know. I'm in the car.
Yeah. So I will.
Is it better? Is there any better? Yeah. So we found ourselves, and got married, and we are really. I think I somehow haven't changed my house, my clinic. So I'm pretty much in touch with a lot of people, and even Ganesham, for example. I have been in touch with when various reasons. And it has been such a great pleasure knowing you guys, and a great privilege knowing all of you. Thanks. You can mute me now.
Yeah, you can. No, you mute yourself, and we shift to the reunion master of them all, Janardhan Chalmela. Bharat Kelkar, are you still on? Bharat Kelkar? I can't see Kelkar. Can anyone see?
Yeah, I'm here.
Okay, Janardhan, please unmute yourself. Janya, please unmute. गया जनार्दन गया. वो नासिक का रियूनियन का बात करने का था ना.
अभी करेंगे.
ए जनिया, unmute yourself यार. Dumb guy. Touch the screen. See, one finger for mobile, two fingers for laptop. Are you on mobile or laptop? One finger or two finger? One finger mobile, two finger laptop. Yeah, so touch your mobile screen. On the lower left side, you will see audio unmute and mute. Lower left. Yeah, now you are unmuted. So Bharat Kelkar and Janardhan to be unmuted. Everybody else to be muted.
Yes.
People wanted to discuss the Nasik reunion next year.
Yeah, sure.
Hello. Bharat, are you saying?
First, Jana,
Okay.
you go on, then I will share.
So if you all remember very well that when we met at Pabi's place, that is in Chembur, that time a lot of guys from our class were present, and that's the time we decided that we'll have a reunion, 50 years, Golden Jubilee, and all the time coming to Lonavala, which is very near, we thought we'll go to some different location. So that's why Bharat is in Nashik, and there are beautiful resorts, especially wine resorts that are there. So we decided to have it in Nashik, and then right now I'm in US with my son, and Bharat had sent me a message saying that Janardhan, let's begin the process. And he had scouted over there and seen a lot of locations. And we formed a group, those who were present for the Lonavala organizing committee. So we've already formed the group. We had several meetings, WhatsApp meeting only. And we've come out with some proposals from Bharat. I think now Bharat will share. Bharat, can you please inform?
Yeah, can you see I'm sharing the screen. Can everyone see that?
Yes.
Yeah.
See, the thing is, the talk right now is going on is of only good things. But there are many funny things we need to share with each other and other things also. So what all of us are, everything concluded that post Diwali and during Thanksgiving time, so that even the people from US can also join.
Yes.
So, and that November is a wonderful climate in Nasik during November. So maybe check-in on 26th and check out on 28th. So 2 nights at Nashik. I have already visited 5 different resorts, the new resorts, which are really wonderful. But we will book the resorts. I already talked with them. Only when we will come to know the number who are ready to come over there. So Janay will probably circulate the Google Doc, and then we'll proceed ahead. We have plenty of time to reschedule if at all something is scheduled during that time. And I request each and everyone from the batch to come over here. And don't worry about the Nashik. Nashik is a wonderful place. And even Jana and Kanchana had come over there to celebrate their special anniversary also. So they know how good things are here. So any question, anything, please come on. Please talk.
Is this a midweek thing?
Yeah, this is a
Yes.
midweek. See, midweek is a bit cheaper. It's a Wednesday check-in and Friday check-out. So we can book the whole resort also for that. We can arrange, there are many wineries there, including Sula, but we can arrange wine tasting of all the things together also.
Only tasting, not drinking.
You have to taste and choose whatever you want here.
You can buy in bulk.
Yeah, you can have bath also in that, no problem.
So भरत खेलकर आगे बढ़ो, हम तुम्हारे साथ हैं.
Yes.
So I think what I'm going to do is I'm going to work out on a Google worksheet or something, and then put it on our Time Pass group and GSI's group, and I will also tell Dwarka and Subodh to put it on their group over there. So in fact, I had a talk with Subodh, and Subodh is the one who told me that this is the best period of time that we can, the people from USA can come. Yeah. And that's why we do it this way. And I would like a lot of people to come in. That's the best thing.
Not a lot of people, everybody to come in. We might
let's make the memorable event. Yes.
See, if we remember last time, I think the first one which we had was in Karjat, and myself and Kanchan, we settled down in Panvel. How many people came? I think 50 to 60 classmates came that time.
Yeah.
We had organized at Karjat. That time Bharat Kelkar was there. Of course, Shahrukh Tata was there, and a lot of other guys were there from here. And then
If I may interrupt, in the year for the 25th, we were 125 people because we had included families. The reunion at Karjat, then the reunion at Duke's, also we had 120 to 30 people. So now we are 75 classmates and the other spouses, something like that we had at Duke's. There were no children. So this time we are hoping that all the groups will inform their groups and we'll have a full house.
Yeah.
We should.
Full house.
Pankaj, can you hear me?
We should consider, is this our last reunion? Because the way things are going between the last 40th and 50th, we have lost 2 people, right?
Yeah.
Right, Pankaj?
Yeah. 3 people.
Pankaj, can you hear me?
Who is the third one? One is Manerikar and apna Ghanasham.
Deepak Dusya.
Deepak Dusya.
Oh, Deepak also passed away. So that's why I think we should meet.
Yeah, we should. We'll try and get everybody. I'll also see in the list. I cannot see picture of the person, but on the list I see Deepak Verlikar is also online. Deepak, can you hear us? Your video is off.
Deepak had come for the last reunion.
Hey, Pankaj, can you hear me?
Who is this?
Pankaj, can you hear me?
Go on. Yeah, Hede, go on. We can hear and we can see you.
Yeah, so it's nice. Okay, perfect. Well, that's good. Finally, I got it. Nice seeing all of you guys. It's been a grand meeting of all these people I've not seen for quite a few years. My memories of GS has been spectacular for the medical part of it. I was always out of the class. I called myself the outstanding person because I was never in the class, but had a great time in the hostel, and those memories will stick forever. That bonding that happens in the hostel, even despite me staying close by, love to stay in the hostel because that meeting of minds, of similar minds, was never to be forgotten. It's nice to see all of you guys together over here, and hopefully we'll meet again in 25 with more people on board.
And you start practicing your singing.
Oh, no. Sorry, that's
No.
done.
We want to hear another good song from you.
Okay, all right. Well, we'll see if my voice holds off or this basically the talent slowly slips away.
Anyway, roll number 1 has joined us.
It looks like a good thing.
Roll number one has joined us as Oppo CPH 2681. Vishnu Agarwal, please unmute yourself. Unmute, please. You have not unmuted. Touch your screen, lower left corner, audio unmuted. Touch the screen. Mobile पे है ना? Lower left corner. Mute and unmute आता है. Lower left corner.
Pankaj, sometimes what happens, the mute one goes to the extreme left and it is not coming on the screen. Tell them to swipe it to the right side.
Yes.
तू बोलना. चाइला.
Hi, Shivaji.
Hi, nice.
अरे विष्णु किधर गए?
विष्णु किधर है?
विष्णु स्क्रीन को टच कर और हाथ ऊपर कर. स्क्रीन टच किया तो हाँ, अभी लोअर लेफ्ट में देख. लोअर लेफ्ट में एक नया पट्टी आएगा, ब्लैक पट्टी. उसमें म्यूट है, लाउड स्पीकर का आइकन है.
One tutorial which we missed in KEM was this: how to use Zoom.
Hey Pankaj, tell him to scroll towards the right side because sometimes that mute button is hidden on the left corner.
अरे तू ही बोल देना भाई.
Hey, किधर है? Vishnu, the lower side, na scroll to the right side so that mute button will be seen immediately. Because there are a lot of buttons below.
गया बेचारा.
I think V.L.Kothari was on there. Just see if he can join.
हाँ, V.L.Kothari वीडियो बंद था, ऑडियो था.
Yeah, he joined.
Anyway, we were able to get 38 online. Praveen Jain is there. Praveen Jain.
Deepak is saying, okay, take it. Praveen.
Hi.
Hi.
ठीक है.
Hi PJ. Hi PJ.
Yes. Another
PJ and PJ.
See, two incidents I want to quote. First one is, our anatomy professor, Dr. Bhatnagar. If anyone remembers him. So he was taking one of the vivas from anatomy. And the first question when I went inside, first question he asked is, what is your name? I said, Praveen. Then he asked me whether you know the meaning of Praveen. I said, yeah, I know the meaning. So I told him whatever the Chatur and all those things, So he said he was very happy, and that makes you, totally your nervousness is gone, once the conversation starts like this. So that is a sign of really great teacher, And second incident which I want to share is, about Sholay movie. What I think one of our guys said, we were, students, first MBBS students that time, 75. And when the Sholay was released, there was so much of demand for that movie's tickets that nobody would get it. But I think 4 or 5 of us, we went, our anatomy, I think dissection group. and we went to Minerva Theatre. The show was houseful as usual. And then we met the manager, and the manager, we told him that we are from KM Hospital, doctors from KM, kindly please arrange seats for us. And he was good enough to, give us a chance to see that movie. So that was, I think Chitra was with me at that time, and there was, I think, Smita, Chitra, me, and someone else, I think, fourth person. So that was really these two good incidents I do remember. Thank you.
Great. Ramanik Chauhan is also there, but his video and audio are both. Are Janvi Gangal is there. Shama.
Alad Kothari is also there.
Kaun?
Alad Kothari.
Alad. Unmute and start talking, please.
Makrand पण आहे. अरे.
Makrand
Can you hear me? Can you hear?
Yes.
Yeah. So I just wanted to quote one particular incident in our first MBBS. I think probably Dwarka has told about that. First MBBS, Dr. Menina was there, our teacher. She entered the class, and I was having a book, The Last Tango in Paris. I was reading it, and I passed it on to Dwarka. Dwarka started reading it, and due to her sense, she immediately made out that Dwarka is reading something. So the book was confiscated, and it was a book which I had taken from a library, and I was bound to return it back. So I approached Dwarka and I said, Dwarka, what is this? I'm going to suffer because of this. So Dwarka had to really go and plead to Dr. Menina and say that I think Dwarka probably might be knowing the thing, whatever transpired between him and Dr. Menina. And ultimately I got the book. And this was a lesson in first MBBS that you have to listen to the teachers first and go on reading books later on. This was what we learned. Yeah. Another thing which I wanted to quote is, in my first MBBS final exams, Dr. Manu Kothari was my, he was my examiner. And as you know, our send-off days, our first MBBS, I had mimicked Dr. J.K. Shah. He was, I think, our demonstrator. J.K. Shah or J.L. Shah?
J.K. Bhatt.
No, Shah. He was a tutor.
That was K.L. Shah.
K.L. Shah, yeah. So I had mimicked him, how he used to walk, how he used to talk and all. And it was remembered by everyone. And at that time, I think Dr. Kothari was also there. So when I entered the room to give my Viva, Dr. Kothari was there and Dr. Lokur was there, from Sion Hospital. So he introduced me to Dr. Lokur, saying that he is a very good mimic artist from our college. And he started asking me to mimic each and every professor instead of asking many questions. Ultimately, he asked me to mimic him. I had to do that. And he asked me only one question. What is ascending reticular activating system? So I was knowing hardly anything about that. I quoted 2-3 words. He said, okay, go. This is how I, gave my Viva first MBBS final anatomy. Yeah. These two incidences I remember.
Interesting, very interesting. Ramanik Chauhan, please start your audio and video. Ramanik Chauhan.
Pankaj, can I make a request?
Hello, Pankaj.
Everybody
Hello, everybody.
Everybody else, please mute your microphone.
Hello, everybody. I'm in the society meeting at present, so that's why I've muted myself. And I'm listening to everybody, and I'm enjoying. And my best time was during hostel time, and taking afternoon nap in the MLT, because we used to have lecture at 1:30. And we had good dabba since we were Mumbai. We had a good dabba from the house, and we used to eat. And I used to sleep in the afternoon in the MLT because that was compulsory lecture I have to attend. So then I used to sleep arams. That's
Okay, now we have Deepak V.L.Kothari online, and when Ramanik talked about going to sleep in the classroom,
You remember me?
my most vivid memory is Deepak V.L.Kothari dozing away in the library. Deepak, please
Yes,
come
yes.
online.
You remember me spending a lot of time in library reading.
Yeah.
Yeah. But I remember regarding one of my professor in medicine, Dr. C.P. Dalwitz. He was fond of eosinophilia, diagnosing eosinophilia always. He used to ask each and every patient, आपको बाथरूम से एक कीड़ा गिरता है क्या? Patient used to say no. तो बोलते कभी तो गिरा होगा, 1 महीने पहले. He used to say, तो बोलते 6 महीने पहले तो गिरा होगा. He was so fond of that diagnosing eosinophilia that ultimately he used to say, yes, see, he is a patient of eosinophilia because he is giving history of passing parasites in the stool. And second, I remember Dr. Ganesham Vaidya always putting a sketches on regarding VN Acharyas and Dr. C.P. Dalvi on the notice board. He used to draw drawings, cartoons of them. And spending my days in MLC and time in library reading and sitting. That's all. And all my friends, Dr. Shashank Parolekar, you, and everybody.
Yeah, you are one bookworm.
I am doing excellently because in my practice till now because of all my teachers, all my colleagues.
Yeah. Quite a few of them. You are right.
Yeah.
Who is left?
Pankaj, Shashank is there. Shashank Parolekar.
He is there?
I think so.
I think we saw him. He's there.
Shashank Parulekar. Acha. I don't see him in the.
No, he was there initially.
Janvi is there.
Participants.
Gangal.
Janvi is there. No?
Janvi is there.
Janvi. Sushma, come on.
Hello. And Nirmala is also there.
Nirmala is there.
Oh, yeah.
Actually, thanks to Nirmala, she reminded us about this meeting. So it's nice to see you all because I missed quite a few get-togethers because I was in US that time. So I'm looking forward for the next reunion, which is probably in Nasik. And one thing I remember, you were all saying about having a nap in the afternoon, but I used to sleep during the lectures. And Pankaj was in my batch. And we were a batch of 13, out of which Smita and myself, only 2 girls were there. So he always used to say, Smita is a beauty and Shama is sleeping beauty because she's always sleeping. Do you remember that, Pankaj?
Yes,
Shama,
nice to see you. Nice to see you after a long time.
I didn't get you.
Who spoke?
You were saying something. I didn't hear you properly.
I think
Sushma's favorite dialogue after every lecture to every teacher was, sir, but, and then she would ask a question. Sir, but.
If I was not sleeping.
Incidentally, my wife's name is also Sushma, by the way.
Yeah, I know that.
So you are retired now from...
I cherish my memories about our first MBBS batch when Chitra, Nimu, Sunita and myself were the partners. So that is the most remembered part of our...
अरे निर्मला का ऑडियो वीडियो दोनों बंद है. निर्मला, please start and join. निर्मला, please start and join. There is no video, there is no audio.
There is no video because here network is very poor. But can you hear?
Pankaj, Deepak, Deepak V.L.Kothari. V.L.Kothari, will you please?
I spoke, na?
I want you to mute because your background voice is coming.
नहीं, V.L.Kothari is stopped his video. His audio is on. Start your video, Virlekar.
Okay.
We have got very little time left now.
I think Sunil Tiwari is also there. Sorry, not Sunil.
Pankaj Kaki.
Rajkishore Tiwari.
Rajkishore, kidhar hai?
I could see him there. Just check it. He's there.
Vishnu is seen. His video is
Makrand is there.
Makrand
Devlalikar.
Rajkishore.
Rajkishore. Pankaj Rajkishore is around.
Hello.
Rajkishore, start your
Hello.
audio. Okay. You are on.
Started. Yeah.
Bolo.
But there's nothing to say. I'm in the clinic, so my patients are busy. I'm busy with the patients. But I'm enjoying all this discussion. And
Where is
all
your
old
clinic?
memories of everybody.
Where is your clinic?
Khetwadi.
Acha. Okay. Okay.
But actually, I'm enjoying all this get together.
Good. You are coming next year for the get together, reunion.
Sure.
I think
50वीं
Makrand is
सालगिरह
left
का
out.
है।
Pankaj Makrand Devlalikar.
मकरंद सबसे पहला हो गया यार।
अरे मैं हो गया।
Yeah, Nirmala, come on. Unmute. Nirmala Rege, please unmute. Unmute yourself.
Me?
Yeah,
Can you?
go on.
Yeah.
Yes.
This is because I'm in Lucknow and very poor network over here. But I could.
No, we can't hear you.
Between there were disruption, but I could hear most of the things what you said, and I really enjoyed it. And all those memories came back to my mind. You can't hear me now, also. Hello.
Yeah, now we can hear.
Hello.
We can hear. We can hear
it's
you.
not possible then for me. Hello.
Yeah. We can hear.
Hello.
We can hear you, Nirmala.
Can you hear me?
Nirmala, if your internet is poor, then you can shut the video and just you can talk.
I think Nitin Rao is there.
Nitin.
Only now
Has Nirmala finished?
Okay.
Has Nirmala finished?
I said that there was a lot of discussion, but
He was very poor.
I could hear most of the. Okay.
No, Nirmala, your audio is very poor. We can't hear you. Nitin Rao now. Nitin.
Can you hear me?
Okay, I
Yes.
will do that.
Yes.
So we are really a blessed lot to have passed through the portals of GS Medical College and having a peer group like us. And we don't realize all this at that time, but now we realize what a peer group we had and what was GS admission meant. So this was a grand time that we had for 5 years. A lot of memories. Pabi spoke about Surit. I want to add an episode about Surit. Surit was with me in school. He was with me in Jain College and he was with me in GS Medical College. And this was during our internship. We were doing our night duty in casualty. And the casualty officer gave us an off at about 5 or 5:30 in the morning. And we were going back home because he used to stay in Khar and then he moved to Juhu. And he had brought his car and we were both going back at 5 in the morning from Parel towards Khar. And from Mahim Causeway to Bandra, when we go on the causeway from Mahim to Bandra, there is a certain curve on the road towards the right side. And I was sitting next to him and I realized this man has gone to sleep. He was not turning along the curve. He was going on the left side. And if I wasn't awake, both of us would have landed up in the Arabian Sea.
You remember? Go ahead.
Just when he was going straight, and not towards the left pavement and not turning, I just looked at him and he had dozed off on the wheel. He had slept on the wheel and he was going straight towards the Arabian Sea. And then I woke him up and then he took a turn and then this was 5 in the morning. You can imagine there was no other car around.
Do you
And
remember
if not for that, if I was also dozing. So this was one of them. The other thing is what I want to point out is the kind of people we had in various departments. For example, in dissection, in histopath, in anatomy, we had this Maharashtrian fellow, I forget his name, Kamdar or somebody. The peon over there. Mamre.
No.
And he, during the exam, when we were examining slides and we really don't know what was happening, this guy would see the slide from without the microscope and say, this is the tooth, this is the columnar epithelium. By just seeing the slide, not under the microscope. They were so good at identifying the slides by just looking at them. Something it may be chipped off or the label or whatever. They were so thoroughly good in their stuff. And we had this in various departments. We had it even in the gynec department. In the gynec department, we had an MTP room where this fellow from he was from Uttarakhand. And he would identify that the houseman has perforated the uterus by just looking at the procedure, even though the houseman doesn't know what he's doing. So this was the level of expertise of all these people who were working in the same department for years on end.
Nitin.
So this was the other thing that happened.
Nitin, do you remember the car number, Suraj's car number? It was a Fiat. Do you remember?
No, I
the
don't.
number?
I don't.
The number was MMU 1214. And this car would come all the way from Juhu with the driver in the front seat and his tiffin in the back seat. The empty car would just bring the tiffin for him. Those days we had 3 cars.
But before Juhu, he was staying in a car bungalow. He had a bungalow of his own.
Okay.
He was staying in a bungalow, very close to my house. So that's how I knew, and we used to go together.
Anybody still left out? Anybody left out yet? Sabka ho gaya?
I saw Vishnu momentarily.
Rajkishore Tiwari.
Rajkishore bola na?
Vishnu.
He's in the dispensary, no? Dipti Shah was to join. Has she joined?
No. She messaged me that it will be too early in the morning. She is in New Zealand.
Yeah. She said that she will try to join. I don't see her, but in case you are.
So before we end, can we have a moment's silence for the friends that we have lost in our journey from 1975 onwards? Was Jagdish Vaswani when we were still doing our internship. Followed by Suraj Parekh, followed by Deepak Dusia, and now this year Ganashyam Vaidya and Anant Kamble Manerikar. Let us observe a moment's silence in memory of the friends who are no longer with us. May their souls get Sadgati. Om Shanti Shanti Shanti.
Kamble also expired.
Yeah, I mentioned him. Thank you. So our coordinators are still online. Aditi, can you hear me?
Yes, sir. Yes, I can.
Pankaj.
Yeah. At the beginning, I told you that I have got some question for you.
Pankaj, Dr. Vaswani.
I mentioned Jagdish Vaswani. Hello. Whose voice is this, please?
Deepak's background. Deepak Verlekar.
Okay. So Aditi.
Yes, sir.
A thing or two about our batch. From the moment our batch joined college for 5 straight years, our batch was the sports champion of the college. Okay. And it was all because of our girls. Everybody agrees?
Yes.
Yes.
Our girls were the leaders, the boys were no less. And for 5 years, we were the champion in elocutions, in sports, in everything. Number one. Number two, you must have heard the word Ganashyam Vaidya being mentioned 2-3 times in our conversation.
Yes.
I'm sure you must have seen his audios and videos. Have
Yes.
you? Yeah. So that was second I wanted to point out. And third, when you mentioned Badal's name, you mentioned sir. How senior is Badal to you? Aditi,
Yes, sir. Yes, sir.
how senior is he to you?
He's senior enough that I call him sir. I'm just in the second year, sir.
No, that's okay. But nowadays we have seen this happening all over Maharashtra. 1 year senior also they call sir. What is this going on? It's pointed out to me by so many other people. No sir anywhere. Natarajan, you agree?
I think, but this is what.
Yeah, we are all peers.
Ah, Natarajan, do you agree?
Yeah, we are all peers, I said.
Yeah, absolutely. अभी ये 1 साल सीनियर है उसको सर बोलते हैं यार, क्या चल रहा है यार?
I told one of my students that you are going to tell one person senior to you, sir, and you are equating me also to sir. Are we both equal? So then she has now stopped talking to him as sir, because in front of patient you tell one person, senior person that sir, and tell me also sir. That means they are being equal. It's like giving Bharat Ratna to everyone.
It's very funny. My son also, while talking of his seniors, he would say, sir. I said, what is this nonsense? Times have changed. Okay. Natarajan, do we have anything more in store?
Yeah. Just wait for a minute. Take over right now. Okay.
Yeah.
Hello, Aditi.
Yes, sir. Yes, sir. I'll take it.
Hello.
Yes, sir.
Proceed with reflections.
Yes, sir. Can we have the reflections video by Dr. Swarupa Bhagwat?
A very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. GS Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was literature and medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book. We, as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
Thank you, sir. We would like to thank our Dean, Dr. Sangeeta Rawat ma'am, and Academic Dean, Dr. Pathak sir, for the continued support and engagement. We thank the Gosumec Alumni Association for administrative support, for correspondence and financial transactions for Dr. M.V.L.Kothari Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Mr. Matre for video recordings. Last but not the least, a big thank you to the whole batch for their enthusiastic participation. Thank you.
One last word. May I, Aditi?
Yes, sir. Sure, sir.
Dr. Sangeeta Rawat was about 3 or 4 years our junior. She is Dr. M.D. Shah's daughter, and she was an intern in our unit of Dr. C.V. Patel. And I have said it then also, and I say it today also, she was the best intern we ever had. When we were residents, she was the best intern in that 2 years we ever had. Everybody, I hope everybody has had a good time. Get ready to meet in 2025.
Yes.
Yes.
Absolutely.
So I have posted this on GSites group and Time Pass group.
And incidentally, if you remember, we have a Facebook group of our class on which I have written and posted 6 articles, okay, of our times in GS. And in these 6 articles, I have just entered second MBBS. I have not even written much about second MBBS. It all pertains to first MBBS. Down memory lane. And they can be easily accessed by the top menu under the menu item called files and documents.
Okay. Bye.
Do go through it. You will enjoy it again.
All right. It was nice
So
seeing
nice
everybody.
of you people.
Nice to meet you all.
Thank you, everyone.
Bye.
Meeting has stopped.
Bye.
Good night.
Bye, everyone.